One of them is called LKB1, which has been identified to be associated with some other cancers like bowel cancers as well. And we have measured it using immunohistochemistry in tissue microarrays constructed from a series of older patients with primary breast cancer. Is a protein, or measuring a kinase called LKB1. So you can actually measure at the protein. It reflects a mutation of that protein. There's been some association with the incidence of diabetes, maybe some relationship with patients treated with metformin. We haven't got the data yet, but that's what we have found in the literature. But what we have found is we measure them in a series of patients, so we would be able to correlate this marker with other markers and the clinical outcome. What we have done is we have got a series of about 600 older patients, older than the age of 70, who were treated by surgery. So we constructed tissue microarrays and then measure LKB1 on the tumors. Alongside that, we also measure another series of over 20 biomarkers. So we would be able to correlate the relationship between that and others. And we also have long-term clinical outcome data. What we have not got at this point in time, and which will be something we are hoping to do, to explore at least, is the relationship with diabetes and their treatment. So we have not got those data yet, but we're hoping to explore those. I think at the moment, if you focus on LKB1, this is still a bit far away from the time when we could potentially use this, but potentially this could be used as a target, like, for example, trastuzumab, using HER2 oncoprotein and so forth, but this is a long way away. But the whole overall concept, or the take-home message as part of the bigger story of this, is that we should pay attention to the biological characteristics of tumors, which might be related to age. For example, the older the patient is, in the context of SIOG, then they might have different biological features. So we cannot ignore these things when we manage patients. Absolutely, absolutely. This is something that one of my research programs is looking into, is how to individualize patients' care from a biological perspective, in this case, by measuring these biomarker levels in the tumors in real time for a particular patient.